there's been an emphasis
Mm-hmm.
in recent history, probably in the last 100 years or so, of healthcare systems transforming not to necessarily improve health, but to make access to health fairer.
Okay.
And so our systems have been designed for fairness as the outcome, as opposed to optimal health and well-being. And just to give you the example of the World Health Organization, in their constitution, they assert that the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being, without distinction of race, religion, political belief, economic or social condition. And from that emerges this concept of universal health coverage, which is essentially based on these three things, which is comprehensive healthcare services,
Sure.
quality healthcare services, and probably the most defining one is all these being provided without an individual or a family being exposed to financial hardship. And it's that last part which changes the whole game. We go from an individualized model of healthcare where you've got a great relationship between, in the East, we'd call it a Vaid, in the Ayurvedic system, or in the West, you'd call it a family physician, where you've got this kind of personal one-to-one interaction, to this model where we are pooling our resources, our wealth, into this kind of third party, which we call government, or what we call social insurance,
right,
to collectivize our health care resources. And essentially, it's that's providing for our healthcare. So can you see how in a collectivized system, it's actually very difficult to even think about individualized healthcare? And it comes with so many challenges. And like I said, it's based on like we all agree that the NHS is an extremely fair system. Whether it supports optimal health is a different question. But it depends on what we as a society value the most.